Doctor, my father is bald. Will I get baldness? Doctor, so many people in my family are bald. I am really worried. Will my son also get baldness? A mother is asking. To answer these kind of questions, I am Dr. Venkataram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Cunningham Road, Banashankari, Bangalore. Baldness is what we call a multifactorial disorder. There is a genetic background, definite genetic background. There is also an environmental influence. Genetic background can be either from the father's side or also from the mother's side. Several researches have happened to identify the gene for baldness. And it is not one gene, multiple genes are involved in it. So, genetic testing to identify a particular gene is still not available, though research is on. We will need a genome mapping for these kind of things. You might have heard recently that Angelina Jolie had a mastectomy. She removed her breast because her family had multiple people having breast cancer. Their genomic analysis showed a particular gene responsible for breast cancer to be present in them. She also had that gene, so she removed the breast. This is what is called precision medicine, which is becoming available now. That means at very young age itself, we analyze the gene mapping and identify what all health problems can occur in that patient. That is a subject of research. It is not available right now for diseases like baldness, but maybe in 10, 20, 30 years it may become available. Till then, gene testing is not possible. But we can make an assessment taking an overall history and the predisposing factors. Now, for example, if both parent families, mother's side and father's side, there is a history of baldness, then there is a strong possibility that the child also may get baldness in future. Likewise, if there is family history of diabetes, family history of blood pressure, obesity, along with baldness, these are all things called metabolic syndrome. So, baldness is one risk factor, family history, baldness is one risk factor. Family history of metabolic syndrome is another risk factors. If they are there, that is a second marker for baldness. Then, if a patient starts thinning early, that is also associated with metabolic syndrome. Then, smoking is another risk factor. Stressful life is another risk factor. So, taking all these things into account, we can make a judgment whether the patient is likely to have baldness or not. Now, when such a patient comes to our clinic, we do two tests. One is called hair scan. You can see the instrument here. This gives an idea of the density in different areas, diameter of the hair in different areas, and that gives us an idea of whether the hair is undergoing miniaturization or not, and helps us to pick up the diagnosis early. We also do a test called trichoscopy. Now here is the instrument for it. This analyzes the scalp under magnification. If the variability in diameter is more than 20%, that means if 20% of the hairs are smaller than the normal diameter, that is an indicator of miniaturization and therefore male pattern hair loss or female pattern hair loss. So here you can see some trichoscopic pictures. So with this we can say that a person is likely to develop baldness in a rough way. But the precise diagnosis, particularly in childhood, will only happen with precision medicine and genomic mapping. That day is far off. So, to summarize, precise gene testing is not available, but an early diagnosis can be made taking into account family history, presence or absence of metabolic syndrome, risk factors such as smoking, and onset of baldness, age at onset. Taking all these things into account, we can analyze and make an assessment whether this is early baldness or not and institute proper therapy. These days, very young people at class 10 are coming with thinning, which is a worrying sign. So, my recommendation to people, please contact us early so that we can analyze and institute proper diet, exercise, lifestyle and treatment as necessary. I hope you have liked this video. Please share it if you have. Please give your feedbacks. Visit venkatcenter.com for more information. Thank you very much.